I will demonstrate a phacoemulsification of a hard and dense nucleus and a small pupil. I recommend for all beginners to use iris hooks for these cases and vision blue in order to stain the interior capsule. I will work without iris hooks in this case and without vision blue. If you are a beginner, do not do so. The pupil in this eye is small. If you do not perform the rhexis along the edge of the pupil, then the rhexis will be too small. Therefore, perform the rhexis along the edge of the pupil as shown in the video. This maneuver is easier with the cystatome than with the capsular rhexis forceps. But even during the rhexis, if you do not succeed, please insert iris retractors. Now you see the rhexis flap coming. Insert iris retractors in order to have a round and complete rhexis. The next step is hydrodissection, always through the tunnel incision, never through the paracentesis, otherwise you will overinflate the anterior chamber and the lens capsule. Perform a good hydrodissection. You will need it for the phacoemulsification. You can start with divide and conquer here in this case. First remove the epinucleus, perform a groove. There are different phaco modes in correlation to the density of the nucleus. So if a phaco mode is too low, switch up to a higher phaco mode with so-called oscillating characteristics, which are perfect for these hard and dense nucleus. I also employ here the chopper in order to crack the groove in two pieces. You see that the nucleus is easy to rotate. Crack again 2 quarters and then continue in the quadrant removal modus. In these very hard nuclei, double check that the groove is complete. So if it's not complete, you must continue with the first groove until it is really complete. You will not be able to remove a quadrant if the first groove is not complete. This is just what I'm doing now. I'm double checking if the main groove is complete. especially in these hard and old nuclei, the part which is close to the posterior capsule tends to be very dense and sticky like a chewing gum, so it might be difficult to crack. Always double check that the groove is complete, that you have two separate halves in order to be able to continue. I am now trying to remove the quadrants, working in the quadrant removal modus, and every bit I try to chop with the manipulator in order to reduce the phaco energy. Don't remove the fragments too close to the endothelium. Try to stay inside the capsular bag and try to make small fragments in order to reduce the phaco energy. Always keep the tip in the middle of the pupil. The risk to aspirate the iris inside the phacotip is very high. If you aspirate the iris once inside the phacotip, you will aspirate it again and again. So keep the phacotip away from the edge of the pupil and feed the phacotip with the lens fragments. As you can see here, the manipulator is the active instrument and the phacotip is the passive instrument. One quadrant more to remove. The next step now is the removal of epinucleus. This is done in the epinucleus modus. No phaco power or very low phaco power and a moderate aspiration. Again, only remove something which you can see. The pupil is small, so if you don't see the structures, you may also push the iris aside with the push-pull instrument. Otherwise, insert iris hooks. Be careful now that the posterior capsule does not pop inside the phacotip. The next step is irrigation aspiration. Also not too easy with small pupil. Move the aspiration handpiece to the edge of the lens capsule, otherwise you will not be able to grasp the cortex. The beginner tends to insert the aspiration handpiece only a little bit, That's wrong. You need to insert the aspiration handpiece to the edge of the lens capsule. Look on the marking of the aspiration handpiece, which is sanded. You can insert the aspiration handpiece to the edge of the sanding of the handpiece. You can check also the drawing in the book, which shows you how far you can insert the aspiration handpiece. You can also push the iris aside with the irrigation handpiece in order to grasp the cortex. The final piece at 12 o'clock. Always tricky. Again, if you do not grasp the final piece, I would make another paracentesis as at 6 o'clock, as shown in the book, and then remove the cortex at 12 o'clock from the paracentesis at 6 o'clock. The cortex here is again very sticky on the lens capsule, very sticky, but it can be removed nicely. The next step is the implementation of a one-piece IOL, which is very easily performed with the push-pull manipulator, then aspiration of viscoelastics and hydration of the paracentesis.